welcome to the regular Friday program of the City Club of Portland. I'm Bill Lesh, your president. I'd like to urge any of you that have not partaken of the special desserts the Benson provided today to go ahead and do so. I've been assured that there's not a calorie on the whole table. And if you believe that, I've got a weather report I'd like to show you. We have a number of announcements before we get to our speaker today, and I ask your patience in doing that. First, I'd like to introduce three new members and ask you to join me in welcoming them to City Club. They are Kirk Carpenter, a sales associate with Stan Wiley, if you'd please stand. Sydney Paredes, manager marketing applications with U.S. West Communications, and Barbara Root, an insurance agent with Coordinated Resources. Welcome to City Club. We have in this week's bulletin an information report that I'd like to call your attention to. Information reports, as I think most of you know, do not require a vote of the membership. This is a follow-up study from one done a couple of years ago on juvenile justice, and this particular report was study of state and local efforts to prevent juvenile delinquency. I'd like to thank the committee members who put in a long time and a lot of hard work. Our reports are the basis for what we are, providing information to you, our members, and to the community. The members of the committee were Duncan Campbell, Gloria Davis, Sandra Decker, Susan Hall, Eve McAllister, Evelyn Snyder, and Muriel Goldman was the chair. I want to thank you all for your fine effort. I'd also like to call to your attention that this is the time of year that we start recruiting for ballot measures. There is a form in this week's bulletin. If you miss the form, call the office and put your name in. We need a number of volunteers to help take a look at various ballot measures that will be on our ballot in November. These are very intense short-term studies lasting 2 to 3 months. They usually meet about one day per week for about an hour to an hour and a half. So I would urge you, if you have the time to commit and don't have a conflict of interest, you might want to take a look at the ballot measures. For example, in my case, if they had one banning advertising agencies, I'd probably have to decline. But if you don't have a conflict with one of them, then please go ahead and volunteer. I first got involved in City Club through a committee, and I can assure you it is the most fun you can have in this organization. I'd like to give the nominating committee report now. The following nominations for the 1990-91 slate will be voted on at our annual meeting on June 29th, a month from today. Nominated by the committee for president-elect is Jim Westwood, who is an attorney with Miller Nash. Nominated for second vice president is Gretchen Lashley, an administrator of OBGYN at Oregon Health Sciences University. And nominated as secretary is Margaret Mahoney, who is director of the Bureau of Buildings for the City of Portland. Nominated for the open positions on the board are Lloyd Anderson, a consultant and former executive director of the Port of Portland, Jill Inskeep, director of human resources with Cadre, Kathy Oxborough, executive assistant with the Oregon Commission for the Blind, Ross Simmons, who is environmental consultant with SRH Associates, Inc., and Chuck Williams, who is media relations officer with Good Samaritan Hospital. I'd like to thank the members of the nominating committee for a fine job. It is one of the tougher jobs that we have, finding people who can commit the time that you need to be on the board. And Phil Bogue, our immediate past president, was chair of that group, and it included Pamela Lesh, Robert Wheel, Bill Wyatt, Tony Zinker, Mary Kramer, and Catherine Holland. I'd like to thank all of you. Continuing for your information, on the board will be Marge Abbott, who is president of Abbott and Associates, James Harris, who is assistant vice president with First Interstate Bank, Chip Greening, who is an attorney with Bogle and Gates, and you will be seeing more of Chip in a moment, and Cheryl Warren, who is executive director for the YWCA. Moving up from president-elect to be your president next year will be Mary Kramer, who is marketing coordinator with Southwest Washington Medical Centers. Pamela Lesh will become the first vice president. She is general manager regulatory affairs with Portland General Corporation, and yes, there is a relationship. Pete Baer, who is a loan officer with National Mortgage Company, will continue as treasurer. Again, that meeting will be June 29th. It should be a very exciting meeting, as John Frohnmeyer, with his flak vest, will come and tell us about how much fun he's having in Washington, D.C. with the arts. So if you have any photographs or anything you'd like to get of Grant, bring it along with you. And speaking of the arts, our program next Friday will be entitled The Arts Center, Who Pays the Bill? Taxpayers only may apply. Panel members will be Mitzi Scott, who is Vice Chair of the Metro Exposition and Recreation Commission, Mike Lindberg, who is a Portland City Commissioner, and David Knowles, who is a Metro Councilor member, and they will discuss the financing and management problems of the Portland Performing Arts Center as the city prepares to transfer it to the Metro Council. And that meeting will be next Friday here in the Benson. And now what you all came to hear, not me, but our featured speaker of the day. Before getting into that, I will introduce again on my far left Chip Greening, an attorney with Bogle & Gates, who is also a board member and vice chair of the program committee for City Club. Chip will have the honor of asking the first question today, and he and Dr. Kohler have been working out that question. We open the meeting for questions, as you all know, from City Club members only. I urge you to ask your questions. There will be a microphone in the center of the room. For those of you who are shy, we do have forms on your table for written questions, but I will warn you that I am a severe editor of written questions. So if you want it straight, then you have to stand up and ask it yourself. And do please remember that questions always end in a question mark. When you mention health care, if you have the courage to do so, the discussion quickly turns into one of cost. Complaints about rising cost, complaints about what it cost you the last time you saw a medical practitioner or a hospital facility. And yet, individually, when we think about health care, we all want our doctors to be as well trained in the most advanced techniques as possible. And we want that hospital, should we have to visit one, to have the most advanced, no matter what the cost, equipment and techniques available should you ever need their services. Our speaker today will address this dichotomy among other hot topics in the area of health care and issues facing health care providers in Oregon. Dr. Peter Kohler is president of the Oregon Health Sciences University. He is striving to elevate OHSU to one of the top 20 medical educational facilities in the United States and is well on his way to do so. At the same time, he is asserting the leadership of OHSU in medical issues facing the state of Oregon and seeking a major leadership position for that facility in the discussions about health care and how it is delivered. Dr. Kohler is a graduate of Duke Medical School. He served for 11 years as chairman of the Department of Medicine at the University of Arkansas. He has also served as dean and professor of medicine at the medical school at the University of Texas in San Antonio, and in 1988 assumed the position of president of Oregon Health Sciences University. He not only assumed that job, but also is a professor in the Department of Medicine there, being one of the recognized experts in this country on endocrinology. Will you help me welcome Dr. Peter Kohler, speaking on OHSU facing the challenges of the 90s. Dr. Kohler.
Thank you. It's a pleasure to be here. As you heard, I'm a relative newcomer to this area of the country. I have become a Blazer fan, and I've been learning a little bit about the university and our role in the community. I was thinking yesterday about how to characterize us in relationship to the other things that are going on here, and I decided maybe a good way would be the quiet university, because I think it's surprising how little you hear about what goes on at OHSU in view of the activities there, and some of which I'll outline for you today. One of the other things I've tried to do is really learn a bit about the state and what it needs. I think it's our responsibility to try to see how we can fill a statewide mission. And I have traveled a good bit around the state learning what I can. In doing so, I have learned, and I've made some of my mistakes, and I've learned a little bit about the sensitivities in different regions of the state. I'll have to tell one story on myself, which I've told before, about a trip that I took to Medford, and I was talking there about the need I felt for somehow redistributing some of our educational activities around the state to more rural areas. And I used the term remote when speaking to some of the medical society members at Medford. That's a no-no for those of you who are not aware. After the meeting, the fellow who invited me there came up and said he appreciated what I had to say, thought we were headed in the right direction, but he would appreciate in the future if I would not use the term remote if I was applying it to Medford. And I assured him that I didn't really think of Medford when I said remote, but I would use any term that he could come up with that would be better, because I do search for precision in wording whenever possible. And he said I didn't have it right then, but he'd come back later. And the next day he called me up and he said he'd thought of the right term that I should use from now on would be less metropolitan. So I've created a little code, and when you hear me say less metropolitan, you'll know what I mean. But also, I know he hasn't totally forgiven me, because I do still get a good bit of correspondence from this particular physician, which he signs remotely yours. Speaking of remote, though, I find that in some ways we are remote, if not isolated, and I have had the opportunity to meet with some of our legislators, and I asked one of the legislators from the southern part of the state if he had ever visited our campus, and he said no, he never had. He wasn't sure where it was. And I said, well, it's in the heart of Portland. I don't see how you can miss it. And we went on talking a little further. It turned out that he was a Blazer fan, and he said that when going home one night after a Blazer game, he had made a wrong turn and had ended up by the Shriners Hospital. I said, well, that's where we are. So we're a bit remote and isolated ourselves. Probably he wouldn't have been able to find a parking place if he had gotten to our campus in daylight hours. We do have some problems we're addressing, trying to resolve. Well, you've heard a little bit about background in terms of health care, and I think the university should play an important role. There are many problems today confronting the whole health care business. Rising costs, duplication of services, inequities of coverage and services, some of which are attempting to be addressed by our legislature. And of course, what we really need is ways to develop answers to a number of these problems. I think we are in danger of losing health care services to some of our rural population. It's an economic and a health issue to various parts of our state. And I also think that there's a lot more that we can do cooperatively, and I know this sounds a little bit on the soft side, but I think the time has come to try to test cooperation in the area of health care provision, and I think that we would like to do that. We, by the way, when I say we, I refer to all of OHSU, have long-standing affiliations with many of the teaching hospitals in the area and other fine institutions like the VA, Medical Research Foundation of Oregon, and the Primate Center, and so forth. So we've had connections before, but I think we would like to see these strengthened in the future. I also think there are a number of sensitive ethical issues in the area of health care that need to be addressed, and someone, and I think logically, often an educational institution, needs to begin to provide answers to these type of questions. And I think we have other opportunities with regard to our own homegrown research to really develop further to the greater good of the city and state of Oregon. While doing all this, I want to reassure all of you that we clearly know and are keeping fastidiously our pledge and responsibility as Oregon Center for Health Sciences, and continuing to provide you with the best bargain in Oregon, I believe, in terms of return for taxpayers' dollar, and we can discuss this further later. One of the things that has been initiated recently since my coming here is a strategic planning initiative. And I'd like to just quote to set you up a bit with some of the components of our mission statement to let you know the ways that we're, I think, trying to go at OHSU. First of all, we are, I believe, the primary center for education for the health professions. We are seeking a spirit of inquiry, initiative, and cooperation, which I've mentioned before. I believe we need to go extensively into the prevention of disease as well as the cure. We will be involved, of course, in the development and the dissemination of new knowledge. We are seeking excellence in education, research, clinical practice, scholarship, and community service. And I think all of these things we hope will be carried out with compassion, personal and institutional integrity and leadership. So these are some of the, I think, pieces of our mission statement. I won't read the whole thing to you. My hope is, though, that these goals will clearly emerge from the discussion that we have today. Now, I'd like to just say a word about who we are, because I really do think there are some misconceptions about that. First of all, we have in excess of 6,000 employees, as you may know. We are Portland's fourth largest employer, and we are the eighth largest employer in the state. We have 1,500 members of our academic staff, augmented by another 1,600 professionals who volunteer time and effort in support of the university. The faculty of our three schools, medicine, nursing, and dentistry, teach in excess of 2,200 students. There are another 20,000 health professionals in the Northwest who take part in our continuing education programs. Every year we see 108,000 or so patients at the University Hospital, Dornbecker Children's Hospital, and our clinics. Now, the comment I made earlier about being a bargain to the state, I'm very serious about. Our budget probably next year will exceed $1/3 of $1 billion. Currently, it's $291 million. That sounds like a lot of tax dollars, I'm sure. But I think what most people don't realize is that we get less than 20%. In fact, right now it's 18.3% of our budget from general funds in the state. We generate a great deal more of it from other sources, including outside the state. At the same time, we provide nearly $70 million of uncompensated health care at our hospitals and clinics, so there's a good deal right there. This accounts for 33% of our gross patient revenues compared to the statewide average of 20%. Everybody has some of this problem. We have a large amount because we are a facility of last resort in many instances. More than half of our patients come from outside the metropolitan area. 1/3 are children. For the many people in this state who cannot afford to pay, OHSU is there. In terms of medical care, we are the social conscience for the state government, and frankly, again, I think the state is getting a good deal, and we are the best bargain at the present time. In terms of our economic impact, it's hard to put a price tag on this. I can give you an idea of our impact on the economy, though. Using standard multipliers that I think every institution does with our $291 million budget, that translates into about a $1.5 billion impact on the economy. And again, 27% of our revenues come from outside the state. This is all without regard to our construction projects. And one of the things I was asked to comment on today was all the construction that we have ongoing on the Hill. Yes, we are responsible for those large cranes you see on the skyline. It seems to be permanent there, and we have a large number of projects underway. However, the state pays for very few of these. Currently, we have 4 projects in various stages of development right now. First is the KCI Institute. This was developed entirely with private money with a very small allotment for the National Eye Institute, $1 million, but most of the $22 million was raised privately and includes a great deal of effort on our own faculty who essentially tithe to this particular effort. So I think there is one that will be a resource to the state that has really not cost the state any taxpayers' money. We have a very exciting new program called the Biomedical Information Communication Center, or BIC. This is built with federal money, and this will allow, I think, a tremendous opportunity for ourselves as well as other area hospitals to communicate with healthcare providers, both physicians, nurse practitioners, and others around the state, and vastly improve the health care. This is going to be an exciting venture. It is supported by the National Library of Medicine, and in many ways is like a National Library of Medicine West. But it's not only a library, it's a communication system, and I'll mention more about that in a minute. We have an addition to our basic science building, which is being built, and we fused 2 projects together in an effort to get more building for the money that we had. One is a basic science addition, very important to us to expand our research programs, which bring in more money to us and to the state. And the second is the Center for Research in Occupational and Environmental Toxicology. That program will be primarily involved in prevention of neurological problems that can result from occupational and environmental toxins. That building is the only one that has any actual state money in it, from the general fund or other sources. Although we do have a nursing school building going up, which will get some money from the state for support and site preparation. The rest of it is again federal. And there is federal money going into the basic science building as well. So of our construction budget, which is somewhere in excess of $130 million, only about $7 million of that came from general funds. And I think if you compare that to any of the other state institutions, colleges, universities, it's rather small. Ultimately, all of these projects, however, will translate into something that will greatly benefit the state economy. So you really can't reduce these to dollars and cents. The expansion of our research and teaching capabilities will have a significant impact on the prestige of our medical school. Really, in a nutshell, the expansion of our research capacity has added significantly to Oregon's economy, and we are emerging through the pack of healthcare universities into a top position, as you heard previously. But I think more importantly, the research and development that goes on within these walls and the level of patient care provided will make a tremendous difference to the quality of health care for future generations of Oregonians. Now, much of the credit for the investment in OHSU's future and the future health care for Oregonians has got to go to Senator Hatfield, who has made certain that these research projects and facilities end up in Oregon and not in another state. Most recently, he and his staff saved our area health education program, which I'll talk to you about in a minute, also from some of my old friends in Texas who had politically tried to take all of the money in that particular program to use in Texas, a typical maneuver, I might say. And Senator Hatfield was able to recover this and bring that program back to Oregon so that we'll be able to set that up beginning this fall. Now, a question about where are we headed? Our mission, you've heard about, remains unchanged. We want to provide the region with top quality teaching, research, and patient care as our top priorities. Our role, however, in the state is changing or should change. We are not intending to be in any way, shape, or form the ivory tower on Pill Hill, a term that I heard when I first came here, and Pill Hill that nobody can find, for example. I think we are and should emerge as leaders in trying to provide solutions to some of the healthcare problems in Oregon. And as the state's medical flagship, if you will, we take this role seriously and without hesitation. We're examining a number of new initiatives and changes at our institution as we make an effort to assert ourselves as leaders in finding answers to some of these tough problems. So our three priorities, teaching, research, and patient care. We're adding a fourth, which is community outreach and public service. I'd like to touch on these four areas of emphasis now, if you will. First of all, in regard to medical education. Currently, the curricula are being revised in all of our schools. Medical school, nursing school, and the dental school. We'll have a much greater emphasis in the future on prevention and on cost-benefit analysis. With new research facilities and programs on board, we believe that our professionals, our healthcare professionals, will be among the best trained in the nation. An important new program that has recently been formulated at the university is our Ethics Center. This is, I think, in this day and age, critically important. The Ethics Center in Healthcare, headed by Dr. Toll, is designed to approach the problems and ethical dilemmas that we face every day in healthcare. And it'll be able to advise our students or provide them at least a framework with which they can address these problems. There are many things in the areas of reproduction, life support systems, as you can imagine, that confront physicians, nurses, and dentists today. I think this center will be invaluable to ourselves and other people around the state in looking at these problems. We recently received a grant from the federal government for $2.25 million to fund the Area Health Education Center. This matches $250,000 provided to us by the state for this particular program, and I think it's going to be extremely valuable in creating a network of education centers around the state in various regions that will allow us to provide part of our education there with the hope that more medical and nursing professionals will settle in the communities where there are shortages at the present time. And I'm personally very committed to this program, as you probably know. Finally, we hope and expect that our medical school will be among the top 20 as the initial target within the next several years. And our goal there is the year 2000, but I would hope it would be sooner than that. For your information, and I think it may not be common knowledge, our nursing school and our dental school, by the usual criteria, are already in the top 10. So I think you can be proud of those schools as part of Oregon educational system. Now, I'd like to move to comment a bit about research. And it's been interesting to me to follow the Governor's Commission activities because it is absolutely, university presidents may not know much, but one thing is absolutely clear. You cannot have an outstanding university without strong research programs. This way, you are able to recruit the very best faculty, which you would not be able to do without research. And I think this is particularly true when the salary structure is low, as it is at OHSU as in the rest of the state system. In terms of salaries for faculty members, you need things that are attractive, and we've got several. We sell Mount Hood every day, and I think the environment is certainly a real plus to us, but strong research programs are also necessary. Another thing that as the debate goes on about research institutions that I find very interesting is when people talk about research universities in the state and where they ought to be, the talk usually focuses on Eugene and Corvallis. And I'd just like to emphasize that in this state, we are the second leading institution in terms of research, which is usually measured, because we don't have precision in this, by healthcare dollars. We are number 2, and I'll let you draw your own conclusions about who's number 1, but we're usually left out of the conversations about research university, and we have a powerful research machine at OHSU, which should become stronger all the time. Now, in the research area, we have several new and exciting projects that I'd like to mention to you. First of all, we have recently formed an Institute for Interventional Therapy. This is done entirely, again, with private money. It is a way to approach human disease without a scalpel, but with catheters, and we hope and think that this will in the future be able to provide a much more cost-effective way to treat a number of diseases such as cancer that we're currently treating now primarily with open surgery. This is a part of our commitment to cost effectiveness in terms of health care. The Balam Institute is a tremendous institution embedded in the university, entirely run on private funds at the present time, built with public money, recruiting exciting young investigators to the OHSU campus, which have a tremendous spin-off effect on the recruitment of other faculty members. They're making great headway into research in molecular biology and the nervous system. I've already mentioned the Center for Research in Occupational Environmental Toxicology, or CROIT, headed by Dr. Peter Spencer. Again, a commitment to prevention, to molecular biology, and positioning ourselves ideally, I think, for health care in the next millennium. We also believe that an overlooked, because it's difficult, area of research that must be emphasized at the university now is health services and health outcome research. And before all the discussions were underway, we were talking to the Center for Health Research and Dr. Greenlick at the Kaiser Permanente. He has now joined our faculty as acting chairman of the Department of Preventive Medicine, establishing a tight relationship between us and his very active Center for Health Research. We're also talking to other people interested in health outcomes research at other institutions such as St. Vincent's, so we can tie these together with the BIC. And if we do this correctly, we would hope that all the healthcare providers in the state could represent a vast pool of information that could be useful to us in making decisions about what is the appropriate step to take in terms of a treatment or not doing a treatment. It's surprising, I think, to people who are not in medicine to know that still a great deal of medical treatment is empirical. And I think that's the problem that the commission trying to prioritize healthcare has had, is how do you weigh one thing versus another? These are critically important questions that we need to answer. In patient care, our activities, we have our two hospitals, University and Dornbecker, and a variety of clinics that really we can't separate from our teaching and research mission. They're linked and intertwined in such a way that they cannot and should not be ever separated. And they should be, however, included in our outreach activities in the future so that research and education go on in anything we do in an outreach fashion. With regard to community service and community outreach and public service, rural health care really is a major problem. The Office of Rural Health in the last session of the legislature was transferred from the Health Division of Human Services to OHSU to help us coordinate our various outreach programs. During that transfer, we lost half of the people in the office, which I hope we can regain in the future, but that should serve us an important role in coordinating what we do and what the needs are around the state. As a result of this, I'm alarmed to find out how many healthcare providing institutions in the smaller areas are on the verge of bankruptcy. Many have already closed, as you know. I think 6 have closed in the last few years. Many others are teetering on the brink. Clinics are being operated in a very marginal fashion, and there are many people who live in the less populated areas who, unless something is done to help their situation, will have great troubles. The Office of Rural Health should help. The Biomedical Information Communication Center, or BIC, should help. We ought to be able to support practitioners who are alone or in small groups with the latest in medical information, and we ought to be able to give them this sense of support so that they can feel at least that they're able to make correct decisions wherever they may be practicing around the state. The AHEC grant itself will be a major resource in this effort. We would like to see in multiple regions of the state a center which can provide and coordinate care and education with a hub and spoke relationship to the very small communities in the state, such as Enterprise, Hermiston, and many others, Burns, that have had difficulty in recruiting and retaining physicians or nurse practitioners. So the AHEC, by putting people in a training capacity in a rural area, will allow us to train people where they may live. The success rate of this type of training program has been substantial. The results generally are that if you train a number of physicians, usually in a primary care specialty in a rural area, approximately 60 to 65% will settle within a 50-mile radius of where they trained. This is because they marry into the community, their children are in school, their spouses have jobs, all those reasons that taking a newly trained physician who's used to living in Portland and trying to thrust them into a rural community may not work, are not the case when you actually have your training in a more rural area. So we hope that this will be one solution to providing more rural practitioners. And it, by the way, also puts an emphasis on primary care, which we feel is very important at the present time. We train about 8 to 9 family practitioners per year and a number of general internists. The steady equilibrium state in Oregon is about 30 per year. Now, of course, they can train somewhere else and move here, but you can see we're really not providing what the state needs in terms of this type of practitioner. Now, in terms of thinking about networking the state electronically, and what I envision is a computer hookup that's got a video, telephone communication, an opportunity to send copies back and forth so that people can read x-rays, for example, or send them to a specialist from one spot to another. And this doesn't have to obviously include only ourselves, but the other Portland area hospitals, the other large hospitals around the state. We've come up with some substantial spin-off advantages. For example, 2 weeks ago today, we had a conference between the university and Nara, Japan, to a meeting attended by about 400 physicians, businessmen in Japan, where we talked about our daughter institute activity through the good offices of our communication system developed by the BIC. What we have found is that this is an ideal arrangement for those of you who are football fans and watch John Madden diagram plays. You can do the same thing with x-rays or any other procedure. You can draw arrows, you can write there, there can be communication back and forth, and in fact you can read x-rays from one very distant spot to another. I think you can see that this provides the basis for a business, we think, that would be a communication system involving several players, and actually AT&T joined us in this effort, and US West had done a similar thing with a linkage that we had to Burns in such a way that I think something new and exciting could be created that's not currently being used. And this can be done at a rather cheap rate, we think $1 to $2 a minute, so that if a physician in Nara, Japan in the future has a particular study that he doesn't understand, he can ring somebody up in Portland and say, would you look at this with me? What am I looking at here and what should I do about it? If we take this another step further, and if we coordinate things here effectively, there is absolutely no reason why affluent Japanese and other people from the Far East should not come to Portland for their health care. This has certainly worked in other parts of the country, and when you are the center of information and when you are contacted for what goes on and what you should do about it, very often this type of relationship develops. And we, frankly, are very much ahead of most of the countries in the Far East in terms of health care. We may be in different relationships with regard to other functions, but we are ahead there and should maintain that lead. So I would hope at one point that we might create a flow of patients to this area of the country that would bring with them some of their resources and allow us to establish ourselves as a major medical center in the Northwest. I can tell you it has worked in Houston, Texas, and when the oil business dived, it was the health industry that really salvaged the city of Houston until oil at least came back in some way, shape, or form. And it's interesting that all of this sort of evolved from our effort to link up communities around this state. We're just taking it internationally instead of statewide. But I think I just need to give you one example of how this can work here. When we dedicated our BIC a while ago, several months ago, there was a patient in Burns who had Lyme disease. And the physician there was able, using this video network, to show our consultant in infectious disease the rash and the laboratory results and so forth. And they had a very nice discussion about appropriate treatment and what should be done with the disease, which is still relatively rare in this state, but it can be used, of course, for all sorts of medical consultation. Now, I'd like to comment a little bit about sort of the healthcare industry as it is, and I see here that I need to move rather quickly. We have lots of problems with what we do in terms of costs now. We want to avoid duplication of services. We have some liaison already and emerging affiliations with some of the hospitals. I'd like to point out a couple in particular that are valuable. The Alzheimer's Disease Center of Oregon, or ADCO, with Good Samaritan, and the VA is important. We've recently signed an affiliation with the Sisters of Providence and the Child's Institute for recruitment of an endocrinologist. We're having discussions with St. Vincent's in cardiology, which I hope will result in a important affiliation. But perhaps the newest and most exciting example of cooperation at the present time is an emerging reality with regard to a children's hospital. Probably, as many of you know, a single children's hospital serving Oregon in this region has long been on my agenda and that of OHSU. There's several reasons for doing this. We'd like to avoid duplication of services at high cost. We'd like to allow the special focus that a single children's hospital provides on the needs of children, and we'd like to upgrade the state's pediatric services to take full advantage of current and future advances in health care. We're not doing that now. We're good, but the very top level of health care is occurring elsewhere at the present time, and we want to be on the cutting edge. We also want to coordinate more effectively with other healthcare activities throughout the state through a single entry point. Now, at the present time in Portland, we have two full-service children's hospitals, Dornbecker at OHSU and the Children's Unit at Emmanuel. Both of these are undisputed top-quality providers of children's care. But as care becomes more specialized, two children's hospitals dilute the medical staff and create an expensive duplication of services and equipment. We believe that it's in the community's best interest, in keeping with the OHSU community outreach agenda, to forge a better solution for Oregon's children. I'm pleased to be able to announce today that our dream for a single children's hospital is tantalizingly close to reality. As of yesterday, OHSU and the Legacy Healthcare System have agreed to work together in an effort to consolidate our programs into a single children's hospital. This is not a decision that is being made lightly at all. In fact, in the last legislative session, Governor Goldschmidt, as part of his children's agenda, obtained state funding for an independent study to determine the feasibility of establishing a single children's hospital. As a result, we have commissioned an independent consultant study, really completed just 2 days ago, which agrees that combining the best of Dornbecker and Emmanuel into a single hospital makes sense for the region and, importantly, is workable. This program certainly has the support of Governor Goldschmidt, Senator Hatfield, and other key officials. I'd say that perhaps more importantly, or as important, it also has the support of the people in the state. A public opinion poll was conducted by the Dornbecker Foundation a while back and indicated that 74% of informed Oregonians surveyed said they supported creation of a single children's hospital. I need to just mention that Portland is, in fact, the largest metropolitan area of the nation without a single dedicated children's hospital to serve the region. Now, this is potentially a benchmark decision for Oregon healthcare, one that is going to require compromise in many quarters, and there's still many questions that need to be answered. We need not only for the administrative, but for the faculty and staff agreement for many issues to take place for this to become a reality. For our part, though, it means that OHSU may establish one of our major programs on a second campus off Marquam Hill. One thing is certain, the Children's Hospital must be closely linked to OHSU's teaching and research efforts. Every outstanding children's hospital in the country combines patient care with medical education research. Such a combination provides the best possible care for sick children. I am extremely optimistic that we will succeed. We are looking forward to continued discussion on this proposition, discussions that will bring together the major healthcare institutions of this community. Chester Stocks, who is here today, and his legacy staff deserve much credit for the spirit of cooperation that they have already brought to these discussions. In conclusion, we at OHSU are convinced that working together, Oregon can create an effective, high-quality healthcare system with access to all and at a reasonable cost. And we're certainly aware of that. The needs of the rural areas and the urban pockets of poverty must be addressed. I believe that the AHEC and other programs that are available will certainly help. As in the case of the Children's Hospital, it may mean cooperative joint ventures and allocating specific programs to prevent overlap and ensure top quality patient care. There are many issues which all of us, healthcare providers, politicians, the business community, and the consumer must be willing to confront head on. For our part, I believe that OHSU should serve as a driving force, a central coordinator for a system which integrates healthcare not only for the city, but for the state of Oregon and the Pacific Northwest. I'll tell you that I certainly commit my energy as OHSU's president to that vision. Thank you very much.
Thank you, Dr. Kohler. The mic is being placed in the center of the room. As I mentioned earlier, questions from City Club members only. Please introduce yourself. If you want to head to the mic right now, please do so. The first question will come from our board host, Chip Greening. If you have a written question, please hold it up so the staff can bring it forward. Thank you. Chip.
Thank you, Bill. Dr. Kohler, at the beginning and at the end of your speech, you said we have to avoid the duplication of services. And yet Portland's hospital bed surplus is well known. In fact, that surplus caused a lot of excitement and stimulated a spirited debate about the construction of the new VA hospital. So here's the zinger for you. Why do we need the university hospital at all? You said that the hospitals cannot be separated from the teaching function of OHSU. But why can't OHSU graduates simply do their internships and residencies at other Portland hospitals which do not get any state general funds?
No. Well, that's an interesting question, and the point I must not have made very clearly is we get so little general fund money as it is. In fact, in terms of our training programs, the university hospital does not really get money for patient care. We provide patient care, and if we were not to do that, there would be $70 million worth distributed to the other hospitals, I would say much to their dismay. We are not an expensive hospital in terms of care, and I think we serve a very important coordinating role. Medical universities can exist without a university hospital, it is true, but none of the top few do that. And it really is, I think, important to rationally look with the other hospitals at how we may work together to solve the problems that they and we all have with regard to the provision of health care. But as I said before, we're an excellent deal for the state in terms of what we provide financially as well as for health care for what we get in return for that.
Yes.
I'm Poppy Warren from the City Club. Dr. Kohler, I'm very impressed by your big vision, your comprehensive outlook, your focus on primary care, on prevention, regionalization, and the community, and rural health care and education, as well as the traditional medical school activities. As you know, I direct a federal HCFA Medicare Alzheimer's project at Good Samaritan Hospital, which is a multi-million-dollar project to study to get the data on costs and utilization of services for the elderly suffering from chronic dementias, as well as for their caregivers, with the ultimate goal of getting a national long-term care policy. This was a congressional appropriation. And as our population ages, the need for chronic care for these people with these diseases and their caregivers increases. There's a move away from the medical acute care model towards the social service model for this population.
Got a question in here
Yep,
somewhere?
I do, and this is it. I had to read it. My question is, do you see, he talks along, I do too. Do you see a role for the medical school in bridging the gap between the acute and chronic care model and bridging the gap between the medical and social services model?
Yes. In fact, I did not have a chance to cover these in detail in my comments earlier, but I think that there are several changes going on in the whole healthcare arena right now. One is the move to more ambulatory care. One is the very important social concerns that I think we need to look at in our aging population. And secondly is what role all of our healthcare facilities should play, not only in Portland but around the state. There are many institutions at the statewide level that are on the brink. I think there are a variety of opportunities to convert some of these to a different type of institution from what they're trying to be in order to avoid, again, the duplication of cost. There are some small hospitals that logically would convert over to highly skilled nursing home type facilities for geriatric patients or for the elderly. There are others that might be converted over to acute care facilities that are more like a way to provide emergency care, the primary access facility model from Montana. Several pieces of legislation have been introduced to do that here in Oregon. But I think what we really need is a careful overview of what's going on in the state. And I think we need to make sense in a composite way of health care here. I do believe that when care can be provided locally, it is more advantageous, but then we should have a careful communication and transportation system so everything isn't duplicated. The small communities do not try to do provide healthcare activities beyond their ability to support these and pay. So I think we're looking now at a time when healthcare costs are likely to escalate higher than they've ever been before unless we do careful planning, partly because of the development of the elderly population. So I think, in answer to your question, we should have a role. I think it's part of our policy deliberations that we need to go through and part of our educational process as well. And I think it can be carried out not only here but around the state.
Dr. Kohler, my name is Larky Deneff. I'm a City Club member and a person with hemophilia and HIV disease.
Yes.
And I have a question about the role of patients. I've been an OHSU patient for 28 years, my whole life. And I want to commend your HIV/AIDS clinic. Dr. Mark Lovelace, I think, has really met your goal of excellent teaching, research, and care around the area of AIDS on a shoestring budget, too. He's been great. And I've found over the years, and particularly working with him as a patient, it's not enough just to go and get care. You have to help educate other care providers. You have to lobby and educate. And I've been involved in that. And I wanted to ask you what role you see other patients could have in helping meet your vision of excellence.
Well, I'm encouraged by what you say. I think, you know, my opportunity here today is really talk about what we're trying to do, and what I feel that we need is some kind of understanding and constituency for the whole healthcare business, if you will. I believe this is going to be particularly important, and that the public needs to be informed and needs to participate. The Health Decisions Parliament, for example, to me is one excellent opportunity to try to bring the non-medical, non-nursing, non-dental public in and look at the healthcare problems that we have and how they can be resolved. But I think an educated public is key to understanding where we need to go, and that perhaps has not been done nearly enough. Although I'd say Oregon perhaps is a leader around the country, much more can still be done. I think it takes volunteer effort on the part of a number of people to accomplish this. So I would look forward to creating some kind of mechanism, but the Oregon Health Decisions Parliament is a good place to start.
I'm Jim Nelson, member of the club. I'm also a member of the Portland Kiwanis Club, and as you might know, they are embarked upon a program or campaign to obtain funds to create a bone marrow transplant clinic at Dornbecker.
Yes.
Now, my question is twofold. One, do you support that? And I trust that you do. But second, your concept of a single children's hospital bothers me somewhat. Does that contemplate the possibility of phasing out Dornbecker, or would it
No.
be possibly a part of it?
Now, I think that the discussions we're having would not, in fact, at all lead to a phasing out of Dornbecker, but a combining of Dornbecker with Emmanuel into a single, stronger unit, which would be highly worthy of support. In fact, we've had a variety of scenarios discussed, and it's really only yesterday that we came to this conclusion, so this is a very timely opportunity to present the information to begin to discuss how this would be worked through. I think it's going to be critically important that our faculty, the medical practitioners at Emmanuel Hospital, the administrative groups, all the various boards and so forth that we all relate to, all be comfortable with this possibility. However, I see that this is being looked at by all of us now in sort of a can-do spirit in such a way that I think it will come about. I would hope that the Dornbecker name would continue in all of this, but again, this is all early right now. But I think that the goal that you have with regard to bone marrow transplantation is a highly laudable one that should be continued, and we would expect it to be important not only in the area of treatments of malignancy, where it can become very valuable, but one of the things that's going to be coming over the next decade is going to be replacement of missing genes in patients with diseases like cystic fibrosis, muscular dystrophy, and so forth. And it will probably be the bone marrow transplantation technology that will lead us on to this form of therapy. So I would encourage you and the Kiwanis Club to absolutely go forward with this effort, and I think it's very, very important to our activities. We need that kind of volunteer help for all of our programs.
If you're both brief, we can get you both in.
And I'll be brief too.
This is very exciting, your announcement, I think, today. I know of your interest in that, in having a single children's hospital. And I'm wondering if you see any obstacles in your way, or what is the worst thing? What could stop this?
What could stop it?
Mm-hmm.
Well, the single worst thing that I think could happen, we happen to have a real opportunity that is unusual in the city in that the child care activities are really concentrated in two areas, two hospitals. And we're talking about bringing these together. The single worst thing that could happen would be for somebody to see that as an opportunity to create a third entity and then have lost the opportunity to bring everything together into a single high-quality children's hospital that can really serve the mission that we see that it should. So I'd say that would be the worst thing that could happen.
Last question.
Dr. Kohler, Fred Neal, City Club member. Would Portland and Oregon's stature and capabilities in research and professional training be enhanced if we were to consolidate OHSU, Portland State, the Oregon Graduate Institute, and others into a single institution of higher education in the Portland metropolitan area?
Right. As you know, this has been one of the questions raised to the Governor's Commission on Higher Education, and I have felt that this is one on which we should keep an open mind. On the other hand, and I think it's actually been presented here as a solution to some of the problems. At the present time, it would seem to me that we have a very specific mission related to health care, and I think Portland State has a very specific mission related to the urban university and its development. And for the moment, I don't see that our coming together will necessarily add up to a greater likelihood for success for our two missions. But I would say that in the future, this should continue to be looked at as does it make sense or not, and I'm always willing to look at it.
Please join me in thanking Dr. Kohler. Dr. Kohler told me before he started speaking that if anyone needs a signed medical excuse not to go back to work on this beautiful day, he'd be happy to give them out. Please join us next week for a discussion of the Performing Arts Center. We are adjourned.